Welcome to another episode of the Holistic Feline and Friends podcast, home for all things holistic and healthful for our pets. I'm your host, Angela, also known as the Holistic Feline on Instagram. Our producer, Fred, is here along with us. In the previous episode, I mentioned that episodes 1, 2, and 5 are dedicated specifically to our little Millie Moonbeam. Some of you know we adopted our very special girl, Millie, who has congenital hydrocephalus from Baby Kitten Rescue a couple years ago, and while under their care, she received life-saving shunt surgery. In episode 1, we spoke to Millie's rescuer, Caroline Grace, who is the founder of Baby Kitten Rescue in Los Angeles. She gave us a glimpse into Millie's life before rescue and journey through her eyes. Baby Kitten Rescue specializes in neonatal, critical care, and special needs kittens. In this episode, we speak to Millie's neurosurgeon, Dr. Jeremy O'Neill, who performed her life-saving shunt surgery. We discuss Millie's hydrocephalus and journey through his eyes. We go deep into Millie's clinical findings, diagnoses, treatment, shunt surgery, revision surgery, all things hydrocephalus, and so much more. Dr. O'Neill is a board-certified veterinary neurologist who practices out of Metropolitan Animal Specialty Hospital, also known as MASH, in Hollywood, California. He, along with other local longtime veterinarian leaders of the practice, have recently become collaborating owners and managers of MASH, ensuring its doors remain open. The most perfect next step and chapter, we are elated MASH will remain open, and with Dr. O'Neill as one of the forefronting pieces of the practice. To our Millie Moonbeam, we love you, and to Dr. O'Neill and the MASH team, we are forever grateful for you and thank you for all you do. Without further ado, please welcome Dr. O'Neill. Welcome, Dr. O'Neill. Thank you for joining us. You are a superstar in vet neurology and within the Holistic Feline and Baby Kitten Rescue online communities. Your magic hands are saving little lives in ways some never thought possible in vet med. You're opening doors, giving hope, and changing lives, and we are so happy to have you. Let's begin by introducing yourself to the world. Can you tell everyone who you are and what you do?
Yeah, my name's Dr. Jeremy O'Neill. I'm a veterinary neurologist in Los Angeles. And so I practice neurology and neurosurgery for primarily dogs and cats. And that's kind of like my day.
Can you explain what neurosurgery means or consists of within veterinary medicine?
Yeah, so in veterinary medicine, it's a little different than human medicine, whereas most neurologists in veterinary medicine are trained for both medical neurology, meaning like seizure disorders, brain diseases. We're also trained in all surgical procedures, and that could include brain surgery, spinal surgery for various types of disorders, from disc herniations, tumors of the spine, malformations, brain tumors. So anything like that, anything that's potentially surgical, most neurologists will do both types of parts of neurology and veterinary medicine.
It's very detailed work. So Millie came to you at Metropolitan Animal Specialty Hospital, also known as MASH, by way of Caroline, who is the founder director of Baby Kitten Rescue, which is a neonatal critical care special needs kitten rescue. She had suspected Millie had hydrocephalus among other quirks and abnormalities and knew you were the perfect human for the case, because you had also worked on a few other of her babies that had brain abnormalities. May we begin with you defining what hydrocephalus is and how it can affect the brain as well as developmental functions?
Yeah, sure. So hydrocephalus is fluid accumulation within the brain, primarily within the ventricular system of the brain. That's the part of the brain that holds all our spinal fluid. And it can come in various different types of forms of why it happens. The most common would be like congenital development, and that could be either the patient, normally our spinal fluid is produced all the time. It's never turned off. So some patients are born with a malformation where the way the fluid flows out of the brain, there's an obstruction or narrowing of the tube that allows the spinal fluid to flow down the spinal cord. And that allows the fluid to build up within the brain itself. The lesser common forms would be like you just make too much spinal fluid, or you're not absorbing it through the normal pathways of spinal fluid absorption.
And how can it affect the brain and the developmental functions?
So when the fluid expands, it kind of compresses the brain tissue. And when it does it over time, it can cause the brain to atrophy or shrink. So that can cause anything from, for our patients, we don't ask them to read, write, things like that. So oftentimes you don't see a lot of neurologic signs until it's quite severe. But it could be behavioral changes from just mental, like dullness, hard to train, litter box or puppy training. They can develop seizures or be quite neurologically abnormal, have problems with maintaining their balance, circling, and like compulsively. Those would be the more common things to see.
So as you mentioned, Millie has congenital hydrocephalus, meaning she was born with it. I know there are many types of hydrocephalus. Can you speak about the different types?
Yeah, there's a lot of different ways to classify it, from being congenital or something obstructive. That's where something blocks the way the spinal fluid flows, and that could be either you're born with it, or sometimes patients can develop brain tumors that press on the brain in areas where the spinal fluid should normally be draining and causes the fluid to build up secondarily to that. So those are usually the most common variations to see that.
What is your experience or knowledge with secondary hydrocephalus caused by FIP?
Yeah, well, that's so feline coronavirus or feline infectious peritonitis, when it affects the nervous system, can result in developing an obstructive hydrocephalus. And that's because that virus has a predilection to affect the cells that line the ventricular system. And so when those cells get swollen or inflamed, that one duct called the mesencephalic aqueduct, that can get narrowed or stenotic, and you get obstruction, or it just produces enough inflammation where it makes the spinal fluid, instead of being normal consistency, which is watery, to thicker and harder to flow through the ventricular system itself. So that's how that causes it, related to FIP.
How would you suggest treating that type of hydrocephalus? Would a shunt be an answer, or would you solely control it with medication?
The issue is the fluid's not normal, so a shunt probably could get clogged a little easier. So you would try and attempt to initially treat it medically, meaning anti-inflammatories and using antiviral medication.
So do you feel a cat in that scenario could live a long life with it being managed solely by medication?
Yeah, I mean, if you can resolve the FIP, then that should go away. Like that hydrocephalus kind of reverses itself. I've treated a few with FIP medically, and they've done quite well.
Okay.
So if you can control the virus and the inflammation, then you've kind of resolved the cause of what's resulting in that hydrocephalus to develop.
Good to know. Okay. Can you walk us through the first time you saw Millie and what her presenting clinical signs were?
Yeah, when we first saw her, she came in February of 2023. Carolyn had just gotten her for a day or two when she brought her in. And she was having periods of ataxia, or kind of just stumbling, walking wobbly, and having abnormal eye movements intermittently at home, called nystagmus, which indicates like a problem with your balance system or having vertigo. She had a rounded, like a slightly larger, and the skull was definitely rounder and smoother than a patient without hydrocephalus. But her eye position was still quite good compared to some of the patients that we can see where the eyes are, due to the expanding skull, the eyes will start deviating outward.
I know when we first started to see photos of Millie, her pupils were very large, inducing dark eyes that were the diameter of her whole eye. There was just a different look about it, and we were wondering if she had any vision issues at that time.
Yeah, she often kept her eyes dilated. I mean, some of that's just your excitement level.
Okay.
Nervousness level can cause your eyes to dilate to do that, because her function was, she's still visual and can see, and all her reflexes for her eyes were normal.
And so the hydrocephalus wouldn't have anything to do with the dilation?
No, not typically. Typically, they're going to be normal pupil size and blind if it's related to the hydrocephalus.
Okay. And so what is the first step in determining hydrocephalus in pets?
Most of the time, we see them where you can you have a good idea just based on their exam with having a larger rounded skull. Occasionally, they'll still have a persistent fontanelle. That's the soft spot that's on the head. And so sometimes that can be even larger than normal, especially when the head is expanding. It can open that space up larger. Those would be like just physical exam type characteristics. And then to kind of get a definitive diagnosis of hydrocephalus, if there's other malformations present, is through doing the most detailed test to give you that information. It's an MRI. You can evaluate the brain in these younger patients if they have that soft spot or the persistent fontanelle. You can perform an ultrasound over the head and see if there looks like there's enlargement of the ventricular system. Oftentimes, if they have a soft spot or the fontanelle, I'll ultrasound them. If it looks consistent with it, then we know that it just confirms it, because you can have a fontanelle like that and not have a significant hydrocephalus associated with it every time. So that just tries to confirm, it looks severe or not. And then from there, move on to the definitive test to evaluate the entire brain as the MRI.
Okay. And can you get any information from an X-ray, or is it only MRI?
Very little.
Okay.
Yeah. It's just going to tell you like the shape of the skull.
So for Millie, what were the tests and procedures she had to determine her hydrocephalus, but also her other abnormalities?
Yeah, she had an X-ray for her leg, and then for the hydrocephalus, we did an MRI of her brain, and we also did an MRI of her spine because she had a curvature of her spine on physical exam. So we were looking to see if that was causing any compression or abnormalities within the spinal cord, because that's going to allow us to make sure that if we're going to try and address the hydrocephalus, that there's no other malformation that would prevent us from doing that, or expectation of how well she can do with that, or is there anything that's going to change in the future?
So in addition to her congenital hydrocephalus, among her other clinical findings were radioplasia, which is missing her radius bone in her right forearm, a cyst on the brain, and then, as you just said, the curvature of her spine, which is a little dip in between her shoulder blades. So can you explain these congenital abnormalities from your perspective, and does the spine curvature affect anything?
Her curvature is called lordosis. That's where it's deviated, what we call ventrally. And it wasn't causing any abnormality within the spinal cord or any alterations to the spinal cord on the MRI. And so that was just a developmental thing that she developed, but there's not a cause for it necessarily. The bones are pretty normal shape and size in the spine there. So that should not get worse or affect her at all. And then I agree with her right front leg with the radial hypoplasia or aplasia, or micromelia is another term that you'll hear with that syndrome. Is just, again, another developmental malformation that she had. And then finally, within the brain, she did have a secondary, besides the enlarged ventricles, likely one of the ventricles had an outpouching, which developed into a cyst, and that started to really compress on a structure called her cerebellum, which controls all our fine motor control and balance. Sometimes those cysts can communicate with the ventricles, sometimes they don't. They don't always communicate. That could potentially influence what you need to do to try and help them surgically, meaning, do they need a shunt? Do they need the cyst removed, or both? And so with Millie, it did look like that the ventricles were communicating with the cyst based on the MRI. So it was elected to just place the shunt. By doing that, reducing the pressure of the spinal fluid within the brain, you're also going to prevent the cyst from expanding. And
so the cyst will always and forever be there. It's not going to go away.
Yeah, the goal is to prevent further enlargement.
Okay. And the cerebellum is movement.
That controls all our fine motor control and balance.
And right now, the size of it is being controlled by the shunt.
Yes. Yeah, that's the thought. Yeah.
Okay. What signs would we see if that cyst started to grow again?
Yeah, I think some of this clinical signs that she was showing was probably related to that cyst potentially changing or filling more with fluid, because she was having signs consistent with problems with her balance, meaning the abnormal eye movements and some of the ataxia. I mean, the decision making to put the shunt for her was response to medication, which she initially responded, and which made her a candidate. Like, it makes you a better candidate, I feel like, to have an expectation that you might be able to help them long term with that. So that was some of the evidence you used to say is which patients do you think are going to be good candidates for that.
And Caroline mentioned that parts of her brain never developed, and it's a clinical term called anencephaly.
She probably has hydran. So there's hydrocephalus, and then there's hydrancephaly. That's where you can have parts of the brain that don't, and the fluid then fills that space. I mean, she does have more than just hydrocephalus. She probably has some other like brain development malformation. This hydrocephalus, when it enlarges, it compresses the brain and shrinks it. But also, there is some other malformations that come with if you have one. So that she probably was born where the brain didn't develop completely. I think she's missing or didn't develop like a completely normal brain that then got expanded by fluid.
My little Millie. It's so crazy to hear all these little things in detail about her little body.
Yeah, because in everyday life, we don't think about all of that. She's
No.
acting completely normally.
Yeah, exactly. That's a good thing.
It's pretty impressive.
Even people are walking around with malformations they don't know unless they go get an MRI sometimes.
Yeah, I don't think about it at all, really. So it's to hear in detail all the clinical findings, and it blows my mind that she's walking around thriving. You would never know.
Yeah, for her, the good thing is she doesn't need medication. Like some patients always still need to be on some medication, but we were able to get her off those medications and she continued to do really well.
You're a rock star.
We just try and make the best decisions for them and give them the best chance.
Well, we appreciate it, including our fur babies. You're 1 in a million.
And I think you're inspiring other people even more than probably you think, because one of the followers on Instagram from Turkey had an issue with her kitty and was wondering what hydrocephalus was, and were able to kind of help, give her some similarities so she could go to the right doctor and ask the right question as well. So I hope this episode will help even more people to know what to look for and maybe what's going on.
Yeah, I think bringing awareness to what is available to help them, and as long as you know the process and expectations and everybody agrees to move forward with the treatments and stuff. But yeah, I think making it something that's available to people, and then they can make the decisions on how they want to proceed with, those treatment options. But being able to try and provide something to help them is the reason why I was getting frustrated with just medicating some of these patients all the time, and needed to try and find better solutions to try and help them.
It's wonderful and beautiful, and it makes my heart happy that we have somebody like you that knows when to use medication, and on the flip side, we'll try to hold back if possible and find alternatives. It's beautiful, and in my experience, there's not many veterinarians that will do that, so I thank you. And yes, I will piggyback on what Fred said. You're making ripples in the world that you probably don't even know by assisting Millie and others. As he said, someone reached out on Instagram asking questions about Millie's hydrocephalus and shunt, and I am by no means an expert on the topic, but I shared with her what I knew from Caroline and yourself. She's from Turkey and ended up getting a shunt for her cat there, and she just kept saying that she wished she was here and could go to you for her cat. So
that's nice.
You're making ripples throughout the world.
It's very special, so we're very thankful to know you and
thank you for saying that. Yeah, I think a lot of it, is also the people that I work with. Some of the clients, and especially Carolyn, and she's definitely persistent in trying to find absolutely what's best and available out there for being an advocate for all her little kittens. So it also takes that side of things to challenge and continue to grow with what we can do. For me, it's a whole team of things. It's my relationship with the clients. It takes more work for me to do some of these things for them, risk for me and to help the patient. And then also with, I rely on a few of my close team members to really help me out with these situations. And
right.
We try and create a system that we can really be successful and help them.
Well, it's working. The system is working.
Yeah.
Yeah, it's just beautiful because we wanted to be sure to let you know that even though at MASH you work on one animal and you're saving that animal's life, and the ones that come in there, you're doing the same for them, but your reach is far greater than only the ones coming into your office. It's seen and heard and felt around the globe at this point, not only from my Instagram, but also Baby Kitten Rescue's Instagram. They all see your work. And even with the 2 Bunny and Otter that you also helped, that's when I first started to follow Baby Kitten Rescue. I'd never seen anything like that. I was just mesmerized. So your reach is far greater than what you may know, and it goes far beyond MASH. So we all thank you.
That's nice. Thank you.
And we were talking on the last episode, we're talking to Caroline, and we're also saying how inspiring it is for humans that can follow Millie and see how she's doing and how she's thriving in life. So I know that some cases, some children with shunt surgeries can see that it's working on a cute cat and makes them feel more confident.
Yeah, exactly.
It's pretty amazing.
It can help them cope with it and understand.
Yeah, it's the same shunt that the kids have. So the kids probably never thought that they would ever see an animal with the same exact shunt that they have. So it's an inspiration.
Yeah, I think recognizing it happens to everybody, or it can happen to anybody or any animal. It helps you understand that, there's ways to try and help, and that people are there to try and help you.
All right. Before we have you walk us through the surgery process, can you describe what a shunt is and the different types of shunts, as well as other treatment options for pets with hydrocephalus who may not have the access or means to attain shunt surgery?
Sounds good. There's a bunch of information and questions in there, but for the shunts, it's referred to as a ventriculoperitoneal shunt, in which that means you're taking the fluid from the brain and moving it drain into the abdominal cavity. And there's 2 big types of shunts from what they do. There's called fixed pressure, meaning they only drain the brain at a certain pressure, and there's a number, and each shunt is set to that pressure only. Then there's programmable shunts, and those are where you can change how much fluid, what pressure it takes to open the valve in the shunt, and you can change that setting based on sometimes the patient's symptoms. And so the shunt has 3 parts to it. One is called a ventricular catheter. That's a tube that goes inside of the brain, and then that tube comes out of the skull and gets attached to a valve. And that could be the fixed pressure valve or a programmable valve. And then that valve gets connected to a second tube, which then gets tunneled just underneath the skin, and then all the way to the abdominal cavity and placed inside the abdominal cavity to absorb the spinal fluid that's being drained. So those are the 2 big types of shunts and the different parts of them. And then if you're trying to treat them medically, the main goal is to reduce any inflammation in the brain or how much spinal fluid is being produced. Okay, the most common medications would be a steroid medication. That could be like something called prednisone, to various types of diuretics or medications that cause fluid to be removed from tissue, and that one could be called Lasix, acetazolamide, or 2 other common medications. And then the last medication that is kind of out there, commonly used, almost everybody comes in either asking about it or taking it, and that is a drug called omeprazole, which is it's an antacid. The same cells that make our acid in our stomach can also help produce spinal fluid. So those are the kind of medication approaches to helping with hydrocephalus. How effective some of these drugs are, it's hard to know. So we usually have them on a combination of medication. And then any symptoms or clinical signs that are associated with having hydrocephalus, like seizures, then you'd have to be on a seizure medication.
Okay, and can you walk us through Millie's surgery, what that day looked like, the preparation, the whole shebang?
Yeah, so it goes to start from just, pre-anesthesia or pre-surgical planning, which was one deciding which shunt to place for Millie. and then selecting location to place the shunt, and then the kind of surgery itself. And so with Millie, she has a very specialized shunt that's not commonly used in veterinary patients at the time. And she has a fully programmable shunt that's MRI safe. And both of her catheters that were used were also antibiotic impregnated to prevent infection. Surgeries anywhere from like an hour and a half to 2 hours. And what it entails is we shave almost their entire head from their eyes and then the entire side of their body all the way down to their kind of abdominal cavity, because we have to prepare that whole surgical field to place the tube kind of into the abdomen at the same time. So they have a really large haircut. And then there is the surgery itself, we make a small incision over the top of the head and then drill 2 small holes through the skull. One is to place called the ventricular catheter into the space that we kind of selected to place it. That tube is then kind of sutured or attached to the other hole that was drilled in the skull and keep it in place. Once that's been kind of secured to the skull, then we ensure that fluid is flowing out of that catheter to make sure that it can drain. And we collect the spinal fluid sample to submit to the lab just to make sure there's no current evidence of anything else in the fluid, like inflammation or anything like that. That tube then gets connected to the valve, and the valve is then kind of sutured in place to the back of the head, upper part of the neck. Her valve is relatively large for her size, especially at the time. And then from there, there's a special device that allows us to pass the tube kind of underneath the skin. We pass this tube tunnel it all the way under the skin from her neck all the way down to the abdomen. And then there's just a very small incision that's made over the abdominal muscles to put the catheter into the abdominal cavity. And then after that, we confirm placement of the shunt and that it looks okay with doing a postoperative CT scan that makes sure that we're in the right location and everything looks like it was placed well.
How do you determine the placement of the shunt?
Yeah, so we just try and find like the part of where we think it's not going, like a larger area, so we can hit it properly and that's not going to rub against other parts of the brain, like the brain stem or things like that. So certain patients is a little more challenging, but when they have larger ventricles like that, it's probably okay to place in kind of various different spots. But some dogs or cats that have other causes, say like some of the obstruction from tumors, the target's a little smaller. So you have to be a little more precise with the placement.
So the shunt is sutured. What type of sutures and what is it sutured to?
Yes, it's non-absorbable suture. And then the valves have little holes on them, so you just suture it down to the patient that way. Yeah, it looks like fishing line.
Wow. And the valve that's on her neck, is it sutured to muscles or what is that sutured to?
Yeah, like the muscle and some of what's called the fascia, which is like the way muscles connect to our bone.
Okay. Wow. That's impressive. So the shunt she has is the same used in pediatrics. Can you tell us more about it?
Yeah, it's a Codman. It's a Codman programmable valve, also made by a company called Integra. Yeah, and it comes with its own specialized device to be able to program it. So you can program them with a handheld device just through the skin. You can turn the valve and open it and close it to different opening pressures. So the patients don't need to be anesthetized or anything, and you can measure their valve setting and even change it, which is nice.
This is a random question, but when we first got her, she hit her head really hard on our credenza, like our little TV stand.
Mm-hmm.
And I was afraid that by her hitting the shunt that hard, it would cause hairline fractures or something in her skull. Is that possible, or is that just something that I made up?
She'd have to hit her head really, really, really hard
to
cause any type of issue with the skull or fracture it.
Okay. Well, good to know, because
we freaked out.
That always terrifies me.
Yeah. I mean, the holes are tiny. They're probably 4 millimeter holes that we had to drill in.
Okay.
So that little bump that she has on her head, that's just the tube coming out?
Yeah, that's where the tube comes out, and then there's an adapter that allows the catheter to kind of make a right angle turn.
Okay.
And so that's used so it can't, so it tries to prevent kinking as you make it turn down the neck. So you feel that adapter and the tube.
Is the shunt pretty much the name of the entire
Yeah,
system?
you would call the shunt
the valve is
yeah,
a
the
portion
valve
of
is
it.
yeah. So you have the catheter that goes from the brain to the valve, and then the catheter that goes from the valve to the abdominal cavity. That whole thing is the shunt, and then you have the individual parts of the shunt.
And so I think it was, I can't remember how many weeks, I don't know, maybe 3 weeks or something after her initial surgery, she had a complication and a revision surgery. Can you speak about what that was?
Yeah, I think the foster at the time brought her in because they saw a little swelling on the side of her abdomen and like a little poofy swelling underneath where the incision was. And so we took an x-ray and saw that the tube was no longer had coiled up underneath the skin and got dislodged. And it was kind of leaking into the space between the skin and the body. So what we did was just made a small incision and repassed that tube in, and then kind of attach it to a few more things to try and prevent it from getting dislodged again.
And so normally the tube is free flowing in her abdomen?
Yeah, under the skin.
Okay.
Well, it is, yeah. Yeah, it is usually just placed in there. We kind of attach to the structure that holds all our intestines together called the omentum. We kind of just tacked it a little bit to that to try and prevent it from like pulling out again.
And so the fluid gets released in there and then just reabsorbed by the body?
Yeah, the body reabsorbs it. Yeah.
And was her hydrocephalus, I had read, and now I can't remember everything. It said that it can be caused by several things. Was her body creating too much of the spinal fluid, or was it just having issues with the releasing of it?
With draining, and some of it was just probably not as much of the brain forming.
Okay, so her body wasn't draining the fluid properly, so that was causing the excess fluid in the brain?
To build up some of it, yeah. And then some of the excess fluid was just a pure result of not being born with all the brain tissue that you're born with. So if you're born with less brain tissue, the body compensates by just filling that space with spinal fluid.
Do we know what was causing, besides that, do we know what was causing her inability to drain it properly?
I think she probably had narrowing of the which is the most common, is the aqueduct. That's the tube that connects our third ventricle to our fourth ventricle. That's the most common spot to see like a congenital hydrocephalus. Either you're not born with it or it's stenotic. It's just too small. So it's harder for the fluid to flow out of the brain.
Makes sense. Was this your first shunt surgery?
No.
Okay.
First one with a programmable valve. That was our first one.
And do you know if there are other pets with the same programmable one that she has, or she the
programmable one? I don't think there's many. If there is, there's not many with that specific one.
Producer, do you have a question?
Yes. How often do you have a shunt or hydro case that needs a shunt surgery?
Or ultimately where we get to discussing that, it's probably once or twice a year.
So it's still pretty rare.
Yeah.
Okay.
Yeah, to get to the point of placement is not that common. You have to get, a lot of them are young. You have to try and get them stable with that and work through some of the placement, some of the complications of the shunt, like understanding the risk with that. And financially, the shunts are expensive as a medical device.
Can adults and senior cat and dogs receive shunts, or is it mostly for younger pets?
Yeah, it depends on the cause. If for congenital, you probably want to do them younger because that's going to try and help them preserve more brain tissue that way. But older dogs can get them if they have a tumor that's causing hydrocephalus, to try and stabilize the pressure in the brain. You can place them so that they can go get their treatment for the tumor, and then you don't have to rely on the shunt anymore. So those are the indications in an older dog where you would you would place a shunt.
And do you see hydrocephalus more in cats or dogs?
I probably see more cats because of mainly and some of my connections with some local cat groups, but it's probably about the same. But I would say cats a little bit more than dogs.
Are there specific breeds of cats or dogs that you see that are more prone to having hydrocephalus?
Cat breeds, no, it's primarily like domestic short-haired cats that we see. Dogs, definitely certain like French bulldogs, Chihuahuas are going to be the common breeds that we see for that.
And why do you think that is for those two breeds?
Some of it is just the shape for Chihuahua. Like they almost all have some degree of like mild hydrocephalus, which is normal. And then the bulldog, they can get a malformation of their where that aqueduct is not necessarily open. So it's English bulldogs and French bulldogs. It's more common in those breeds.
For the ones that you mentioned that may have mild hydrocephalus,
Yeah,
does that still need to be controlled by medication or a shunt?
usually not.
Well, that's cool.
Yeah. So I'll get patients that come in, they say they have hydrocephalus, and I say it's probably not going to be a problem and they don't need any treatment.
So if one has mild hydrocephalus, can it
Mhm.
increase to, or does it just stay mild?
Usually, if you don't see them before a year old and you see it's like an incidental finding sometimes, if they have an MRI for another reason, then it's not going to be an issue. But most of the time, if they're symptomatic or have clinical signs before that, it's probably going to need some long-term medication.
So it won't necessarily, like, let's say the Chihuahua is 2 years old and has had
Yeah,
mild.
he's probably not going to have an issue.
Okay.
Yeah.
So if he's had mild hydrocephalus his whole 2-year-old life, it's not going to
Yeah.
increase.
Yeah, unlikely. If it's not bad, like progressive by then yeah, it's probably not going to be an issue.
What is the post-op care?
That's primarily just like you're watching the incisions for any swelling, infection, discharge, monitoring for seizures, or a decline in kind of their neurologic symptoms from what they had beforehand. Because you want to watch for signs of complications associated with the placement of the shunt.
And I know we do in the beginning, it was a 6-month recheck, and then it was 8 to 12, and now it's about once a year recheck. And can you talk a little bit about what you're looking for and how you're...
I'm just confirming that the valve setting is where we had set it, and there's been no change in that setting. Palpate the shunt itself, make sure there's no movement, things like that is what we're looking at that time. Do you need to do that? I don't know if you necessarily need to do that, but I'm doing it because I want to just stay in touch and keep that information.
I like it. It makes us feel better about it all too, to know that we check in and make sure she's all up to par. So during the recheck, are you checking the flow of the fluid?
No, the only way to check flow, you'd have to kind of inject fluid into it, and then you can take the x-rays and see if it's traveling down the catheters and into the abdominal cavity.
Okay.
There's some risk with that. You can introduce infection and things like that. For me, unless there's a change in their status and we're not doing that, we're checking her valve setting is what we're checking. It's still the same.
Can the valve setting accidentally change on its own?
I don't think so, but I think if you have the way that the device works to change the valve is a magnet. Like it's a really heavy magnet that can turn the valve. I don't suspect it should change on its own, but I'm doing it because I just want to monitor the valve and make sure it's where we set it.
And I guess my last question with that would be, how do you determine the flow setting, and then how do you check to see if that flow setting needs to be changed?
That's a big question because there's not a lot of information out there for these pressures, what pressure to set them at or how you come up with a shunt. A lot of the early studies looked at the pressures in the shunts, and they use really low, what we call low pressure or ultra low pressure valves, which opens really low pressure, and it can train issues. If you have too low of a pressure opening, you can cause more fluid than you want to leave the brain. And that's called overshunting, and that can cause serious complications. So that's a risk. You don't want to overshunt them. There can be attempts to try and identify what the true pressure is. We just don't have that equipment readily available to us. So for me, I place the shunt at the known normal pressure for cats and then monitor their symptoms. And if they're not improving, I will change the valve to open at a lower pressure and then see if they get better. For me, I try to place them close to normal, like what normal pressure is for cats, and then adjust it based on that. And in patients with like fixed pressure shunts where we don't have the ability to change that valve, I tend to put it at the pressure or one that's slightly below normal.
And how often do you see that suffices and you don't have to go back in there and redo it?
Yeah, right now they've been, like the last 4 have been pretty good. So we haven't had to change them or had issues with over shunting.
Beautiful. So for Millie, as long as her symptoms stay as is, there would be no concern or reason for a different setting?
Correct, yeah.
And if the setting were to be increase or decrease, would her symptoms present the same for either or?
If you increase the opening pressure, she'd probably get similar symptoms than what she had when she first came in. And then if you lower it, what can happen if you remove too much pressure, the brain, instead of being inflated and pushed up by the fluid, it can collapse down off the skull. It can cause some pretty serious things like bleeding around the brain. So they can come in quite neurologically affected, like circling, bad seizures, blindness, things like that.
Good to know. Thank you.
Yeah, we don't want that.
No, that was why, when I talked with Carolyn, I was like, these are our options for shunts, and these are the risks. And that was elected because that gave us more flexibility in trying to determine what the right pressure is to open, because you don't want to overshunt them.
Yeah, certainly not.
Yeah.
Do you have any advice to listeners who may have a hydro pet or may come across one in their lifetime?
Yeah, I think I would meet with somebody like a neurologist to get their opinion on what's going on and the options available, and that to know that the option to place a shunt is available to them if that's something that they would want to proceed, if we think they're a good candidate. So that's a big discussion to have with the client and the doctor seeing them, to try and say, because you want to do it for the best candidates, because that's going to give everybody the best outcome, the patients and everybody. So that's a discussion to have, and as long as they understand, what's involved, the monitoring, the complications, and how those can be dealt with, it makes those decisions easier. As once everybody has all the information, you have to make the best decisions for that individual patient. So I would get as much information, and then as a group, it's a mutual decision to do these things, to place the shunts or to treat them medically. It's not just one person saying this is what you do. I think you need to have that mutual conclusion of that's how we're going to proceed, because you may have to deal with a complication. There's anywhere from 25 to 30% chance that at some point, like Millie had one, which was a minor one, but it would be considered one where the tube came out. Kinking of the tubes getting clogged, pain at the surgical sites, or even developing seizures. Like, those are all the more common complications that are reported. So you just have to know that this is happening, this is how we're going to deal with them. And if everybody agrees, then we move forward with the treatment plan. A lot of dogs and cats can do okay, even with medications, but it probably depends on, which age you're seeing them. The super young patients, unfortunately, when I see them 6 to 12 weeks old, that are really severely affected, those are not the best candidates for surgery. They're so young, and it can be quite challenging.
You mentioned earlier that it's a pretty costly procedure as well. Can you talk about kind of a range of what it costs to really get something like this?
Yeah, I think the first step is to try and get a diagnosis. That's your first step, so that requires an MRI. And so MRI's probably going to cost anywhere between, depends on where you are in the country and stuff, anywhere from $2,500 to $4,000 to do it. And that's going to give you your diagnosis and come up with a plan if this is an option or not. And then the surgery itself, it really depends on, the biggest factor is which shunt is selected because there's a drastic difference in cost for the shunts. The shunts themselves can cost anywhere from like $1,800 to $2,000. Those are for like fixed pressure type shunt. And then for Millie shunt, not only the shunt, but she had the specialized catheters that were antibiotic impregnated. I think overall that it's probably gone up since her surgery, but it's just the device was probably close to $7,000, $7,500 for just the device.
So she's got the Rolls Royce.
And then the surgery.
Okay.
Yeah, she has the most advanced. She has the best, most advanced shunt that's available.
Wow.
That's on the market. Yeah, and then it's the surgical fees, which can range anywhere from probably $5,000 to $8,000 on top of the cost of the shunt.
Okay.
I think that's in general. So there's multiple levels to getting to that decision and making that decision on which shunt and all of those factors.
Millie's a special gal, and Caroline went all out.
Yeah, we had to do research, reach out to our local rep, make sure that we can get the device to monitor her valve, adjust the valve as needed. We had to do some stuff in the background to try and get set up so that we can long-term get set up to do these. Whereas with the fixed pressure ones, there's nothing to do after surgery. You're not going to be changing them. You don't need equipment to check the valve. Those valves you can check even her valve, you can check by x-raying them. You can check the setting on the valve with an x-ray too. For me, I had to investigate and get equipment and talk to the company to get all set up for her.
How long does a shunt typically last?
They should last a long time. I don't think they have a shelf life from after placement.
Because I think I've read somewhere that it might need replaced after so many years, like 7 to 10 years or something like that. Would that be the same case for her?
Maybe. I'd have to look. I don't know if there's anything on that. I'd have to look into that, to be honest.
I think we heard that for humans as well.
Yeah.
Yeah.
I'm sure they try and swap them out.
Before we come to a close, are there any thoughts you'd like to share?
Yeah, I think I would just try and meet with somebody if you have a concern about your pet with having hydrocephalus, to meet with a neurologist to just know what is available to you moving forward. It doesn't necessarily mean that you're gonna need a shunt or that's the only recommendation, but we're here to support you with the decisions that you make and help those patients manage them medically if they need it. But I think reaching out to somebody and just talking with them and seeing what's available, and that there are lots of dogs and cats that can benefit from just having that conversation and support.
I agree. And if you don't live in an area where a veterinary neurologist is accessible, there are some who may offer virtual consults. So do a bit of research and reach out to see if a conversation is possible. And so can you let everyone know where they can find you?
Yeah, I'm at, MASH, or Metropolitan Animal Specialty Hospital. We're located in Hollywood in Los Angeles. We're a multi-specialty hospital with every specialty available to most patients. Now our department has grown, so we're larger now, have multiple neurologists on staff, and we can be reached via email to the neurology department, which is just neuro@mash.vet. We could answer some questions or give the hospital a call. Find us on the internet at mash.vet.
And their Instagram is @mashvet. Well, we can't say thank you enough for joining us. It's a topic we don't hear much about, and I'm happy to bring your expertise to explain it in a clinical fashion and through your eyes. You're very special to us and to Millie, so thank you for all you have done and continue to do for her and all the little lives you open your door and heart to. Your magic hands are a true gift, a real-life earth angel, which I have said to you many of times. Thank you for doing what you do and for believing in these furry loves and giving them a chance to live long, healthful lives. We thank you, and Millie thanks you.
Yeah, we love Millie.
Oh,
yeah,
she's popular favorite over there. Yeah, she's a fan favorite over there.
Yeah.
On the Holistic Feline Instagram, her fans have chosen the name Moonies to be her fan base name. So Taylor Swift has Swifties. Lady Gaga has
Oh,
monsters. Millie has Moonies. And so there's a lot of Moonies at MASH that we see when we're there, and we appreciate it.
Thank you for having me on and bringing more awareness to this. And I was happy to be here to go over this.
Thank you for listening to the Holistic Feline and Friends podcast. It is created, hosted, produced, and released with love. And my hope is you learn something along the way. When we know better, we do better. Please share your knowledge and our podcast with others. For more educational content, follow us on your favorite podcast platform, as well as Instagram at The Holistic Feline and online at theholisticfeline.com, where you will also find our blog that includes corresponding posts for each podcast episode with links to all the good stuff. Thank you again. We'll see you in the next episode.
The Holistic Feline and Friends podcast, website, blog, and socials are for informational and educational purposes only. All information, suggestions, recommendations, or comments, whether by written, verbal, audio, or otherwise either direct, indirect, or association, is not a substitute for professional veterinary care. Please provide your pets with a minimum annual professional veterinary visit, and more often when health concerns arise. The Holistic Feline, Angela Warwick, and all guests and associates are speaking from experience and education. Please continue your research and form your own opinion. This is in no way a means to diagnose.